Hi there, welcome to the June All Hands Update. I am thrilled to be with you here today. So here is what we're going to talk about. We're going to first talk about the strategic 10-year goals, which I always like to remind you of. Our strategic 10-year goals, first of all, is to ensure that every complex continuous care patient who lives in the state of Connecticut and is able to live at home safely and wants to, we want to ensure as a company that they have a care team and a funding system available for them to live safely at home. It is our hope that we can provide care to many of these people. We certainly don't imagine that we're going to provide care to all of them, but we want to make sure anybody who is in this situation has a path to do that. And so the way that we do that is providing remarkable care to all the families and patients that we come into contact with. We act as advocates in every way we can for families, and we work with the state as well as the government federally to make sure we have laws that are passed and regulations that are in place and the funding mechanisms that can support bringing the teams together. And it's also about if we can't find the right fit for a particular family here, we want to look to find a particular fit with another agency. We want to partner with other agencies in Connecticut to make sure that these families are safe and they can be at home. And so that's our first big strategic goal, and it's sort of our outward-facing goal. Our inward-facing goal is to be the preferred employer of home health nurses in the state of Connecticut. We want to be the best at that. We want to be absolutely stellar at enrolling, engaging, training, and retaining our nurses and our home health aides and other care providers. We want to stand out as being a preferred provider. We know that we don't always do everything right. We know that we slip and fall at this, but we are really, truly trying every day to be the best that we can at being your preferred employer. So I wanted to talk next about how we're going about getting there in 2019. So our what we call our WIGs, if you'll recall from last month, we introduced the 4Ds, the 4 disciplines of execution. So as part of that, we've assigned 2 primary WIGs for the entire company. We met last month, in the month of May, and we got together as a team, those in the office, and our leadership team, and we discussed what would be our wildly important goals. And these are what they are. So number 1, we want to meet our monthly hours forecast goals. So this means that we want to grow every month. We want to be surrounding our families, our current families, with remarkable care. We want to fill schedules. We want any openings to be filled with the right people. We want to bring on new patients as well. We have patients who are waiting to come home. They're waiting for us. In particular, right now, we have patients that are waiting in Danbury and Hartford, and we really want to bring them home. We have a couple that have been literally sitting in hospitals waiting for us to have the right people in place. So we want to grow our hours and through that be able to provide care to these patients that are waiting for care. This is important for the ongoing health and sustainability of Allume. We need to grow our hours so we're at a place what we call in financial terms break even. So there's a magic that comes when we hit about 15,000 hours. When we hit about that many hours in a given month, we're at break even, and that gives us the ability to be more independent and not have to rely on the sources of our investors. So it's a very important goal for 2019. So number 2, we have another WIG, okay? It's another wildly important goal, and it's really, both of these goals are equally important, so 1 or 2, it doesn't really matter. They're both super important. Number 2, be survey ready at all times. So this speaks to our clinical operations and to our ability to maintain and preserve our license and accreditation with the state and federal government, right? We cannot operate if we do not attend to the rules and be compliant. So that is a very important, sort of like foundational piece. And oftentimes, most employers, most agencies will get tied up in just doing that. We want to make it so that we make this a goal now, we focus on it, we get it done, and then we can get on with other things. We aspire to be more than just survey ready and compliant. We want to be remarkable. We want to stand out. We want to do the extra, go the extra mile. We want to focus on customer service and employee satisfaction. So this time is about also ironing out the kinks of our operations. Everything from getting our notes in on time to processing notes properly, having our payroll obviously run properly, and we've made giant steps forward with that, although I know it's been hard and we've had some challenges over the course of the last year with that, and we appreciate all of your patience and understanding as we grow. We want to make sure that when the services are provided, the documentation is done correctly. We want to make sure that it's done on time. We want to make sure that the orders are communicated back and forth to the doctors, that the communication between the nurses is appropriate and documented. Education is documented and all of that. And then we want to make sure that once we pass it on to QA, it gets taken care of quickly, and you, if you need to, are able to provide any updates, and then we're able to pass it on to our billing, have it billed, and bill in a way that is compliant. So they like us to bill in ways that are specific. So if we don't do that, then it can cause us trouble later. So we want to get the survey readiness knocked out down, and so that we have a really smooth operation. We're doing a lot with this right now. We are actively doing sort of surprise mock surveys. So we're having outside agency and outside company come in to help us do that. We're also building our own method of self-reflecting and self-measuring. So every month, starting next month, we're going to start doing mock surveys in-house. You might see as we do this, a supervisor might come out and do some observations in the field of visits and so forth to make sure everything is going just right, and planning and pretending like we're being visited by the state or being visited by our accreditation partner. So that's what some of the big stuff that's happening now. You can see our company milestones. You are familiar with these. Here we are at 6,300 hours. So we're well on our way to getting to, this says May, it should say June. No, it's actually correct. That's correct. We're in June now. So in May, we hit 6,300 hours. That was great. We were up by over 1,000 hours from the month before. I want to say like 1,200 hours. That was a big boost. Thanks to all of you and our fulfillment team and our orientation team. Then we want to be able to get to 13,500 hours by the end of the year, and that will happen by continuing to do what we're doing, bringing in new nurses, training them, and moving them into the field, putting them into open schedules, as well as moving them into new patients. So that's been really fun and really exciting. So key objectives for the year. So we have the WIGs, which are like number one top things, and these are the other things that are helping us grow. So we want to grow continuous care by 700 hours a month. And because we did not grow in 700 hours the first couple of months, right now we're having to catch up. But we are doing really well, and this was in a red state or a yellow to red state a few months ago. It's now yellow to green. We grew from 5,500 hours in March to 6,300 hours in April. I don't think that's right. 8,200 hours in May. I think I'm off by a month here. So 5,500 in April, 6,300 in May, and 8,200 is what we're on track to do in the month of June. So we're good about that. We're excited. That's really, really wonderful. Now we're growing also skilled medical. So that is also going from yellow to green. Skilled medical census is now at 22. It's grown from 15 in January. So that's great. We did 134 visits in April. That grew from 86 in January. We've hired, onboarded, and we want to hire, onboard, and train nurses. So We are hiring, not quite at the pace we'd like, but almost. We're getting better. So hired 8 in January, 10 in February, 7 in March, 13 in April, and 10 in May. So we're hoping in the month of June to get it all the way to have it break a record and have it be at 15. Next is we are, of course, offering our $500 employee referral bonus opportunity, and we're doing a big event, a Hartford hiring event on June 26th. You're going to see more of that coming out, but on June 26th from 10 a.m. to 3 p.m. we're going to have an event at a co-working space in Hartford or West Hartford to bring in nurses from that area. We want to increase our average hours per week per care provider from 25 up to 25 hours. We're still hovering at about 20 hours a week, so that's still at a yellow. 95% of visit notes completed on time. So this is going to be a really big focus for the rest of the year, and more of that will come out in the 4Ds training later this month. We are going to be doing a monthly drawing for those who have on-time notes. So if you can win $250 if you have all of your notes in on time. So, and I'll tell you what, the number of people who actually get their notes in on time every single month is not that big of a pool. And so $250 you could win pretty easily. So I would highly suggest you make that an effort, not just to mail it in on Friday and hope it gets there on Monday, but really make sure it's in the office by Monday at 12 p.m. If it's after that, it's late, and you don't get the $250. Then we'll also be doing some kind of a grand prize for those who, for the rest of the year, will receive, who have on-time notes. So we're going to have a big challenge. We're going to set it up. I haven't decided yet what the prize is going to be, but it's going to be a big prize. It's for anybody who makes it. Everyone who gets it makes it with all on-time notes through the end of the year, you're going to get a big prize. It's going to be significant. So watch for that. Next one is no more than one call out per employee. We seem to be doing pretty well on. 80% fully scheduled for continuous care patients. We're about 75%. 90% fully scheduled for continuous care patients who've been on service for more than 3 months. We're about 86%. So that's pretty good too. What else is happening? So you may recall we had a DPH, Department of Public Health, survey in March, and we are continuing to work on the correction plan from that. That's important, and you'll continue to see education coming out around that, and we'll continue to clean that up. It's also part of our second WIG that I mentioned earlier in this discussion. We are also working on annual competencies. So that was supposed to be completed last month in May, but we have a huge number of people that are still needing to do it. Well, I shouldn't say huge. I think it's about 15. So if you're one of those people, please reach out to your case manager. I believe your case manager has reached out to you in the last week or so, and get it done. It needs to get done. If you don't get it done, you will be taken off the schedule. Who wants to have consequences like that, right? It's not good for you. It's not good for anybody. We're continuing to implement the 4Ds. We'll talk more about that in a later training video. We are rolling out the Access Continuous Care e-note. So last month we had training on it. Hopefully you did the training. Hopefully you also completed your first 3 notes, actual electronic notes in Access. If you haven't done that yet, you need to do that ASAP. We are going to be rolling it out to one house, one patient at a time. So you'll hear from us very soon. And if you get your notes done in Access, you won't have to necessarily come into the office to get the training. Okay, so I would highly recommend you do that and avoid having to come to the office in order to continue to be active on the shift. We're also very busy preparing for our ACHC survey. As I mentioned before, we're doing some mock surveys every month, and some we're doing ourselves and some we're having others help us. So these are some of the things that are happening right now at Allume. Okay, so that's all I have for today. I hope you have a wonderful month, and I look forward to being with you again very, very soon. All right, and go make the world a better place. Bye.